Can we get the PowerPoint up? Yeah. There we go. Hello, everybody. My name is Vasja. I'm the CEO and co-founder of a company called IRYO. It's a pleasure to be here. What's really interesting for me is that I actually have a degree in international relations, so I definitely, I guess at some point I thought that I will work at the UN or some other international organization, but I didn't think it was going to be in the role that it is today, but that's how life works, so I think that's quite interesting. A few disclaimers before I dig into this. I wanted to be as hands-on as possible, so I wanted to give you a demo of what we developed, but unfortunately there were some technical difficulties, so the PowerPoint is going to have to do, but afterwards, if anyone's interested, you can come up to me and I can show you hands-on all the stuff that we've done so far. What I want to present today or talk about is the case for a medical passport for refugees. And just a few disclaimers before I start. I'm going to go into really specific things here, and I think we have Simon here then to pull us out of the specifics and give us some more of a general frame or framework of what we're discussing here. And also, IRYO is a completely for-profit company. We're a startup based in Slovenia. And so this was sort of a project we did on the side because we met an NGO that we thought was doing great work in the Middle East. And we thought we could help them with the tools that we're kind of developing anyway. So keep that in mind as well. So the thing that I want to present to you today is, I'm sure, something that many of you have encountered, and you've probably encountered it when you either moved location for a job or were just changing your family doctor. And the thing that happens is that you always need to compile a list of all your medical records, and then you need to transfer them to a new doctor. It's really important for the medical professional who's treating you to have those records. Now, if you live somewhere where there's functioning institutions, those records are usually held by a healthcare provider, and you don't have to think about it a lot. With the refugees, that's very different. And so if you have that pain of trying to compile a complete medical history of yourself, maybe once every 10 years, sometimes the refugees have to do that for every visit to the doctor. And so the main issue really is that to have cost-effective and efficient treatment, we need to have historical healthcare data of a person. So the way we started thinking about this is that who's more interested in preserving that data than every single person? Now again, if we live in a normal state of things, then we don't care about this very much, but it's quite different for the refugees. This quest for a personal health record is not something that is a new idea. And in where I come from, it's sort of a nice to have, but among the refugees, we think it's a necessity and it's the only way to provide or to ensure that the medical history of a particular person remains stored somewhere. So how do we go about achieving something like that? The first thing that's a bit tricky here is we had power cuts, now we have lights going on and off, which is nice, keeping us on our toes. Christmas, yeah. So we need tools for both sides. We need tools for doctors to input the data, and then we need tools for the patient to access and keep that data. The other thing that is sort of specific to what we were doing for this particular project is that the solution must be designed for the refugee situation, which means that there's going to be unreliable internet connection, there's going to be low budget equipment, you're going to have to capture data that you might not necessarily have to capture in the developed world, and so on and so on. So if we focus on the healthcare providers first, the medical staff, what did they? So we've been working with an American NGO who's been providing healthcare in the Middle East alongside the UN, and they've been sort of doing that as a standalone organization there, and they've been trying to collect medical records of the refugees there. Right now we're working in Syria and Jordan, in Lebanon and Jordan for the Syrian refugees. And the refugees stay in those camps on average between 5 to 7 years. So it's quite important for the NGO to try to store the medical history of the refugees that come visit a doctor for a particular thing. So right now they had sort of two alternatives how they could do this. They could either invest in an on-premise electronic health record solution, or they could use a cloud-based electronic health record solution. The first one is usually expensive, it's highly customizable, which is a good thing, but then you have to have it deployed locally somewhere. And it doesn't usually back up any of the data anywhere else. And then you have the sort of newer cloud-based solutions, which is usually affordable, it's usually quite cheap, but it's not customizable. And then again, it will back up data onto a remote location somewhere, but it usually needs internet to work. And we know that in a lot of those locations, the internet comes and goes a lot, like electricity here today. So those are kind of the two options. And then both of those options have this other issue, which is the interoperability of healthcare data, which is a whole different topic, and there's conferences organized on that topic. So they all store data in a proprietary format, and the data is not owned by the patient. And with the first one, with the proprietary format, what I mean is that if someone else would try to import that data into a new system, it would be difficult to do that. So what we decided to do is an EHR solution it was specifically designed for the NGO that's working there, but it was designed in a way that it doesn't need internet to work. It works locally on any computer. You can set it up very quickly, but it will store all the data on that computer. It will store it on a cloud, and it will also send it to a patient app. The data, the solution uses open data standards, which means that we're trying to be as interoperable as technically possible. And when there is internet, the data will be synced among different doctors or different local clinics that they have running over there, and it will be sent to the patient's phone. So the whole architecture provides independence and robustness. So it's kind of like each piece of software that they run is sort of an independent organism, so it can work without anyone else, but it will exchange data between different nodes when it has internet. And then the other thing where it becomes really interesting is, so now we've been talking about primarily how the medical staff enters the data, and then if the patient comes back, they can look up that data again, they can see the health records, and they can provide a better treatment. Where we think this becomes even more interesting is that if we start looking at new technologies and how to utilize that. And so the first one that, again, every conference like this sort of has is everyone's talking about blockchain. But what's really interesting for us here is that once you have that data sent on a patient's phone, through blockchain, we can ensure that that data is not tampered with, so we can ensure immutability. So we might not necessarily be able to figure out what data has been changed. For example, if a patient would want to go in and change their data about vaccination or what have you, but we would know straight away whether it was tampered or not. So if we do that, we can then turn that application or that data on the phone into a full-fledged medical passport. Of course, there's legal requirements to be able to do that, but from a tech point of view, that's something that we could do. And then the other one, which is probably more talked about, is the tokenization of that the blockchain enables. And so what I mean by that is that we all know that there's companies out there that earn a lot of money selling data. That's basically what Google and Facebook do, in a way. They say it nicer than that, but that's basically what they do. And there's definitely pharmaceutical companies out there who are willing to pay for certain types of data as well. And what we can also enable through that is that if we get to a large enough data set that companies would be interested in that, and if we offer a way to anonymize that data, then the refugees could actually sell that data and get some monetary compensation in return, which again, coming from a developed world, you know, a couple of dollars to sell that data might not be life-changing, but sometimes life-changing drugs are not more than a couple of dollars. And sometimes people aren't able to afford that. So that's one thing. And then the other thing, where I think it becomes even more interesting in terms of more of a wider issue of data ownership and data control and so on, is zero knowledge data storage. That's something that we're working on. That's still a fairly new technological concept, and what it means is that any data that we store, because we still store all of the data in a centrally controlled cloud as a backup. If the refugees lose the phone, they could sort of come back to the data that we store for them. What we are trying to do is to store that in a zero knowledge fashion, which means we give every end user or every refugee in this case a private key with which the data is encrypted, and so all the data that comes to our servers is already fully encrypted, so we cannot tell what that data is unless that person gives us the key. So that means they give us the explicit permission to decrypt the data. And so we think that's a really powerful way of storing sensitive information, and it's really the only way to give control over the data to the end user. Otherwise, there's always ways to get around that. And then obviously there's with blockchain, there's sort of this built-in identity where the refugee can easily demonstrate that they are the owners of that data. It's kind of like when you need to demonstrate that you own your iPhone or your laptop. It's really easy. You just type in your password. If the password's correct, assuming nobody stole it from you, then we all know that the device is yours. That was sort of the idea behind what we've been doing with this project. I don't have screenshots of the actual application because, like I said, I wanted to give you a demo, which I can still do later on a laptop, not on a big screen, but I do have a couple of photos just to show you where this has been deployed. So this is one type of a clinic that they use over there. Is just a shipping container that they've remodeled into a clinic that they can move around, and so we've equipped them with laptops and they have the software running there, and that's what they're doing now. So that's all I had. Thank you very much.